Gynecomastia is one of the most common problems that we see in men. Enlargement of the male chest, or gynecomastia, is seen in some studies up to 30, 40, or even 50% of men at some point in their life. Whether the young 13 to 15-year-old or the older gentleman, we're all bothered by that enlargement of the male chest. Well, gynecomastia is a little bit different from patient to patient based upon their anatomy. Sometimes it's skin, sometimes it's excessive fat, and sometimes it's excessive breast tissue. So when I evaluate my patients, I determine what procedure to do to the male chest based upon their anatomical problems. Liposuction is very common for me to do. I introduce a small liposuction cannula, and I often will even use the newest smart liposuction, which is laser-assisted liposuction, to get rid and melt that fat away. Sometimes I have to make a small incision around the nipple area to remove excessive breast tissue that may be there. A combination of removing extra breast tissue and removing fat with liposuction is the most common sort of gynecomastia reduction surgery that I do. This is an in-office procedure. It takes about 45 minutes, and the men go home in about an hour or two after the surgery and take a day or two off from work. They often can't go back to the gym for about 3 or 4 weeks. The final swelling resolves in about 6 months or a little bit more, but even after about a week or so after the surgery, their chest is much flatter. I do have my patients wear an undershirt or a vest to keep compression on the area after the surgery. So overall, gynecomastia surgery will help reduce that male chest and is really not a big ordeal in terms of recovery. Patients love this procedure and they can go back to their normal activities very quickly.